Hi guys, Jane here. So this is another What Is It video, and it's about Bipolar Type 1. What is Bipolar Type 1? Let's get started. I am not a mental health professional, therefore please do not use this video as a diagnostic tool. This is just an educational video so that people can be informed about what Bipolar Type 1 is. So since I'm not a mental health professional, please feel free to leave any comments, additional info, or corrections down below so that we can make this platform more educational. Now, if you still want to confirm the validity of my research, all the links that I have used are down in the description box below. Okay, let's get on with the video. So what is Bipolar Type 1? It's basically a mood disorder characterized by a series of manic episodes and depressive episodes. Now, there are 4 types of bipolar disorders. One is bipolar type 1, bipolar type 2, cyclothymia, and NOS, which is not otherwise specified. Now, I'm only going to discuss type 1 in this video just because there are definitely specific criteria that needs to be met for each type. And since they are different in their own ways, even though they're all bipolar disorder, I'm going to make them into separate videos. So what is the diagnosis process, and what are even the signs and symptoms of bipolar type 1? Basically, the person needs to have at least one manic and one depressive episode. Now, I'm going to be discussing manic episodes, and then I'm going to be discussing depressive episodes. So what are manic episodes? According to the DSM, it is, quote, distinct period of abnormally and persistently elevated, expansive, or irritable mood, end quote. The manic episode must last for at least a week, and they must have 3 or more of the following symptoms. Number 1, high self-esteem. So for a person with bipolar disorder, they might feel like they are the king of the world. They might feel very good about themselves, almost to the point where some people might think that they might be arrogant or just really grandiose about themselves. Well, whatever it is, they are feeling really, really good about themselves in a very extreme way. Number 2 is little need for sleep. Now, I'm not just talking about 5 to 6 hours of sleep. I'm talking about 1 to 3 hours of sleep, and they feel like they had a good night's sleep. Like, I know, that's pretty crazy. However, they do feel rested, even with just a very little amount of sleep. Third is flight of ideas. Now, their mind may be racing at that moment. Like, there's so many thoughts, so many ideas that are going 100 miles per hour in their mind. Like, it's just chaos in there, but it's just so filled with just ideas and thoughts. Fourth symptom is increased speech. Now, it can be the rate, so they might be talking fast, or they might be talking a lot, or they might be pressured to speak a lot. Whatever it is, even though it can manifest in different ways, they talk a lot. Fifth symptom is getting very easily distracted. So they might be very, very distracted in the external stimuli that are around them. And I know that the symptoms that I am portraying to you guys might seem like they're a bit ADHD. So that's one of the reasons why people with bipolar disorder get misdiagnosed as an ADHD. Because when they're in their manic episode, they can portray ADHD-like symptoms. Sixth, an increased interest in goals or activities. So they might feel very, very productive at this moment, whether it's clubs or school or work, whatever it is. They are very goal-directed in whatever pursuits that they want to conquer. Seventh is psychomotor agitation. So they might be really pacey, they can't really sit still, and they're very restless because they're just so full of energy. Eighth, increased pursuit in activities that involve high risk of danger. Now, I'm talking about the classic binge eating, shopping sprees, unsafe sex, drinking and driving, you name it. It can manifest in different ways, but because they are so highly impulsive during these manic episodes, they can partake in those dangerous activities. Now, if there's going to be a high side, there's going to be a low side. Here are the major depressive episodes. They must last for at least a week, and they must have at least 4 of the following symptoms. Number 1 is changes in appetite or weight. So they might be overeating and gaining weight, or they might be undereating and losing weight. Number 2, they have decreased energy. They feel so fatigued. They feel like sloths. They can't get up in the morning. They can't shower. They're just paralyzed. Number 3 is feelings of guilt or worthlessness. Now, they might feel as if they're the worst people in the whole wide world. All the things that are happening in their lives are their fault, and they just feel so crappy about themselves. They feel so inferior, and their self-esteem goes way down. Like, I know in their manic episodes, they might have a very high self-esteem, but when they're in their lows, they have a very, very low self-esteem. Number 4, they might have trouble thinking, concentrating, or making decisions. So basically, the cognitive processes that they go through are especially hindered during this time. They might not feel like focusing, they just can't think because they're just so wallowed up in their sadness and worthlessness that it really is hard for them to think and concentrate. 5th, this is kind of a very serious symptom, but it is thoughts of suicide or self-harm. So this can be a very dangerous symptom because if they don't get it treated enough, they might actually attempt to suicide themselves, and that is one of the reasons why I want to make this video, is because if you recognize this in yourself or others, you can inform them to get help immediately and go to a mental health professional to go get it checked out. Now remember what I told you guys, this is not a diagnostic tool. So if you ever find yourself going like, whoa, this sounds a lot like me, please go seek a mental health professional. It can't hurt. Now, what are the risk factors of bipolar type 1? The first one is genetics. Basically, if you have a family member or a relative that has bipolar type 1, you might be more susceptible in getting bipolar type 1. Just because they feel like there is a genetic component to this disorder. Second one is periods of high stress, trauma, etc. So if someone is going through a very tough period in their time, whether it's abuse, bullying, or other very highly traumatic events or periods in their lives, it can induce somebody to develop bipolar type 1 in the future. Number 3, drugs or alcohol abuse. So drugs can definitely alter one's mood, and therefore, if abused, it can lead to the possibility of developing bipolar type 1. What are some psychotherapy treatments for bipolar type 1? Well, one is called CBT, which is cognitive behavioral therapy. It basically examines how your thoughts and emotions affect your actions and how you can change your thoughts or emotions in order to elicit a better action. Number 2 is mindfulness meditation. So basically that is your classic yoga or mindful breathing and, just being in the present moment. Now, other types of therapies that are also used but not so commonly known are light and dark therapy, social rhythm therapy, interpersonal therapy, and even acupuncture. Yes, even acupuncture may help. What are the medications that they use for bipolar type 1? So basically the first line of medication that they use are mood stabilizers, namely lithium. They use lithium because lithium is a mood stabilizer, and this is just a disclaimer for lithium, but if taken in very high doses, it can be very toxic to the body, and they are not as effective in mixed episodes or rapid cycling. Now, what do I mean by that? Mixed episodes are basically when the person with bipolar type 1 can experience mania and depression at the same exact time. I know, that's mind-blowing. How can that even happen? But that can happen, and those are called mixed episodes. Now, rapid cycling is basically when they go through a manic and depressive episode very quickly. Second line of medication are anticonvulsants. Now, they're basically anti-seizure drugs, but I know, how can anti-seizure drugs be used for bipolar? But it definitely helps with mood stabilization. Now, I'm talking about the classic Lamictal or Topamax. Also, antipsychotics can be used as well. Usually, antipsychotics are combined with the mood stabilizers to make the effect of the medications greater. Or if the person experiences psychosis. Now, psychosis is basically seeing things that are not there or hearing things that are not there, or they're detached from reality. If they do present those psychotic symptoms, antipsychotics can also be in their line of treatment. Now, the last line. Many people discourage the use of this medication. Antidepressants. The reason why antidepressants are so unpopular in the bipolar arena is that there are there are a lot of problems that can arise. Number one, antidepressants can induce manic episodes. Therefore, antidepressants might not be as effective. Going on to my second argument. There are many studies that have shown that antidepressants are not even as effective for treating bipolar patients, and that they're nothing better than a placebo. Number three is that antidepressants can increase mood cycling. As I told you before, mood cycling is the switching between a manic episode and a depressive episode. So basically, if a mood stabilizer can do this and try to minimize the fluctuation, antidepressants have the potency of making them go like this. Now, you don't want that to happen, and antidepressants have the potency to do that. Now, what are some statistics of bipolar type 1? Now, I'm not trying to tell you guys these statistics to scare you guys off. I'm saying this so that you guys can face the reality of what people with bipolar type 1 go through. I'm just going to read it off here. The average age of onset is about 25, but it can occur in teens and more uncommonly in children as well. Number two, the conditions affect men and women equally. So men and women are equally likely to get bipolar type 1. 2.6% of the U.S. population are diagnosed with bipolar disorder, and nearly 83% of cases are classified as severe. Yikes. So what are my final thoughts about bipolar type 1? It is definitely a difficult condition because there's just so much instability in the patient's life that, you know, they just feel so chaotic and they just feel so unstable that it can really impede their functioning in their daily life. Now, I know that there's a lot of stigma that revolves around bipolar type 1, but bipolar disorder is not just simple mood fluctuations. If some girl is on her period and she's like flinging out her mood swings, that does not mean that she has bipolar disorder. Just because somebody's emotions are way more chaotic and, you know, they might be more, you know, angry, or they might be having more mood swings, that doesn't necessarily mean that they're bipolar. So the next time you see someone that might be a little moody, don't just say, "Oh my gosh, you're so bipolar." Like, instead, just realize that people who actually have been diagnosed with bipolar disorder are suffering way more than you can ever realize. So let's get rid of the stigma of bipolar disorder. People with bipolar disorder do not deserve this kind of stigma or discrimination, and let's be the ones to make that step first. Let's challenge ourselves to reduce this stigma and accept them for who they are despite their hardships and difficulties that they have with bipolar disorder. Thank you so much for watching, guys. I post every Mondays, and so please stay tuned for more videos. Bye, guys.